16,957 individuals that have been tested positive for COVID-19, 1,154 in our ICUs. That represents a 4.2% increase from the previous day. 2,714 individuals that are hospitalized in our system. That represents a 3.9% increase from the previous day. Sadly, we had one of our highest death rates in the state, and that was 68 individuals that passed away over the last 24 hours. We now have 442 individuals that have lost their lives. We're only at 37.2% of that number that have reported in. And currently, 30% of those within that data set of 6,306, 30% are identified as Hispanic, Latino, Latina, 6% within the Black community, and 14% within the Asian community. It tracks modestly so along the lines of total population. So 30% positives in the Latino community, 29% of the deaths so far within the Latino community based upon that sample size. 6% Blacks positive, 3% of the deaths. And as I said, 14% Asians tested positive, 16% of the deaths. If you go to a hospital, you could be tested for the novel coronavirus, and treatment is compensated in those hospital acute care emergency department settings. That's not the case if you go to a community clinic. That's now just changed. We are providing presumptive eligibility, regardless of your immigration status, at our community clinics. And we're not waiting for a waiver that we have already requested of the federal government. We have been doing our part over the course of the last number of weeks to punch above our weight. We've been able to secure over 41.5 million N95 masks, in some cases collaboratively, in other cases across our respective jurisdictions and sometimes against each other in the open market to compete. In some cases, we've been actually competing against the federal government. You've seen price gouging. Yesterday, a request to utilize money from our disaster response emergency operations account that would allow us to invest over $1.4 billion into PPE of all stripes, not just the healthcare workers in the state of California within the hospital systems and our community clinics, but also our grocery workers, our DMV workers, the frontline employees. We believe with these contracts, multiple contracts and multiple sources, we'll be able to bring into the state of California and procure and begin to distribute at a scale that we haven't been able to date. So with that, I want to ask the director of the Office of Emergency Service to come up. He'll fill in the blanks on some of the details.
And yesterday, we were able to establish an agreement with a company, California-based company called BYD America, which really has a direct reach back into China to be able to build a pipeline, a sustainable amount of monthly masks that will be coming in to assist us here in California. The last piece that we've been working with FEMA on is leveraging a new piece of technology. It's a technology that is designed to get on the ground and actually bring in used N95 masks and do a sterilization and cleaning process that makes them basically new again. Been certified by the FDA and CDC, and it will be here in California, here within the next week, ability to clean up to 80,000 masks per day.